Hi, this is Rachel Cooper. I'm a licensed independent clinical social worker and the manager of client services, and I'll be talking today about patient support services and referrals to community-based organizations. First, I want to start out just talking a little bit about why it's important to understand roles and responsibilities of different members of the patient's care team. So, to work effectively within a patient-centered medical home, it's essential to understand the nature of each of the team members' roles. Interdisciplinary collaboration requires clear communication, common goal setting, problem solving, and a strong understanding of each member's role on the care team. Healthcare professionals often have overlapping skills and roles. Clarifying each member's roles helps to reduce conflict, mitigate role ambiguity, dissolve professional boundaries, and build trusting relationships. Healthcare professionals work in an ever-changing environment with limited resources, which demands a team approach to provide optimal patient care. Understanding the distinctive role of each member of the team and their unique contribution to patient care helps ensure continuity of care and prevents duplication of efforts. So, who makes community-based referrals? There are several people in the care team that make referrals to community-based organizations, and that's what we're going to talk about in more depth. The clinical care manager, the care coordinator, the behavioral health consultant, and the client service case manager all make referrals to community-based organizations. And the better we understand each other's roles and responsibilities, the better we'll be able to work together. So, who are the clinical care managers? Well, these are our nurses. They're formerly called nurse case managers, RNs, and LPNs. Their role is to organize, coordinate, and provide clinical care management to patients within the practice who are most at risk for health deterioration, sentinel events, and poor outcomes, and they coordinate care. They're really the lead on the care team. They triage, they participate within the primary care team, they implement and develop care plans, they can do some streamlining of business operations and institute measures to improve care. Within 48 hours of notification, they follow up on high-risk patients, and they perform all the nursing functions within the parameters of their licenses, and actively participate in the orientation of new nursing personnel. So, who are the client service case managers and social workers? Well, you can see some of our photos there. We have several different people on our staff with who have degrees in different disciplines, master's or bachelor's degrees in social work, human services, or related fields. And their role is to assess needs, organize, and coordinate services for patients who are most at risk for health deterioration. And they're really focused on psychosocial needs. They provide assessment and ongoing case management, coordinate health and social services for clients, assure that clients are connected to community services as well as financial benefits and entitlements, empower clients for self-advocacy, conduct some off-site social service and home visits and health visits when appropriate, and establish and maintain relationships with outside community agencies. They also contribute to the collection and maintenance of demographic and service utilization data for different grants and contracts that we have in our department, and collaborate with medical staff and other staff to develop and implement patient care plans via multidisciplinary case conferences and individual provider meetings, and they also do some referral and appointment management. So the care coordinators, they're bachelor's level staff, and they're usually very experienced with care management and project coordination. They coordinate and facilitate patient care across the continuum of care. They're a patient advocate and liaison. They deal with patient support and transition of care issues, promote patient healthy behavior changes, and quality improvement and performance measurement. They also have some educational and technical assistance duties. They are the ones who are primarily responsible for ensuring that clinical standards are met for the alternative quality contracts, achieved through reviewing reports, coordinating with providers, and outreach to patients regarding these performance measures. They support patients to access appointments, manage emergency room follow-ups, help with patient navigation, so potentially they can accompany patients to appointments as necessary, and they do help with transportation, so registering patients for PT1s, for example. Behavioral health consultants and specialists, who are they? Well, again, they're a combination of different disciplines. So you have clinical social workers, PsyDs, PhDs, licensed marriage family therapists, licensed mental health counselors, and interns in the above fields. The integrated consultants provide assessment, education, and brief intervention to patients within the primary care setting, evaluating the mind body behavior connection and providing brief, solution focused interventions. Specialty mental health, they conduct full biopsychosocial assessments, psychological testing, mental health treatment, including medication management therapy. The key roles are assessment, education, and brief intervention to patients, and evaluating the mind body behavior connection as well. The types of referrals for integrated behavioral health consultants could be around issues where there's patients with potential mental health diagnosis, patients needing help with healthy related behavior changes such as smoking cessation or obesity, patients with stress or coping difficulties, grieving or dying patients, family members of patients with illness or disabilities, patients with medical adherence difficulties, patients who repeatedly see providers with no clear reason. So, the integrated behavioral health consultants can assist with some of these patients by helping to set self management goals and doing some short term, brief solution focused work with them. So, what type of referrals do clinical care managers make? Well, they make medical referrals. As part of the patient's care team, the clinical care manager refers to community agencies as and when appropriate. They make referrals related to medical issues, for example, to VNAs, CSPs, and home health aides. For more complex psychosocial needs, or when a case manager support as part of the care team would benefit the patient, the clinical care manager should refer to the client service case manager for help. As the main person responsible for updating and maintaining the plan of care, the clinical care manager may input who will be doing what on the plan and track this closely. What type of referrals do care coordinators make? They make referrals that may relate to support and transition of care. Patients may be being discharged from the hospital, for example. They might refer to client services when psychosocial issues are complex and a case manager needs to be part of the care team. They also might make referrals to community agencies when appropriate, for example, for transportation like the PT1. What type of referrals do client service case managers and social workers make? Well, cases are referred to the client services case manager by all the different disciplines we've talked about: the clinical care manager, the care coordinator, the behavioral health consultant, or the provider. So, as part of the patient's care team, the client service case manager will refer to community agencies. They handle complex psychosocial issues which impact a patient's overall health and well being. They can also provide one off information, advice, or support to patients and providers regarding psychosocial issues. And they're working to develop an open access program based on a drop in model to support patients efficiently as they offer, and we also offer group case management and workshops on various topics. Things around benefits, food stamps, housing, financial issues, all of these sorts of issues are often referred to client service case managers. What type of referrals do behavioral health consultants and specialty clinicians make? Behavioral health consultants act as part of the patient's care team, providing consultation and specialty mental health as appropriate. They make referrals for ongoing mental health or substance use services. They refer to client services for social support, psychosocial support, and community services. They also refer for appropriate psychopharmacology treatment. So the behavioral health services in the Boston sites, they've got on-site integrated behavioral health consultants and specialty mental health providers. And in Hyannis, we have some contract services with Gosnold. The integrated services are not yet available. Something to keep in mind when you're considering community-based referrals are the CSP programs. So these programs really provide some really great services to patients who qualify. They provide an array of services delivered by a community-based mobile multidisciplinary team of paraprofessionals. So people who might qualify are Mass Health and Medicaid patients with a long-standing history of psychiatric or substance abuse disorders, Mass Health Medicaid patients who are varying degrees of increased medical risk, and Mass Health Medicaid members' children and adolescents who have behavioral health issues challenging their optimal level of functioning in the home and community. So CSP workers can go out to homes, help reduce barriers to attending appointments, increase adherence, and this is all funded through Mass Health and Medicaid. Who could benefit? Well, individuals who have a disorder that's required hospitalization or has resulted in serious impairment with a risk of hospitalization. CSP services are often used to prevent repeat hospitalizations or first-time hospitalizations. They're designed to respond to the needs of individuals whose pattern of utilization of services or clinical profile indicates a high risk of readmission into 24-hour treatment settings. And these services are designed to be flexible to support individuals who are unable to independently access and sustain involvement with the needed services. So there are several contracted providers for community support programs, or CSPs. Finding the appropriate program for your patient and client can be done in conjunction with other members of the patient's care team. Client services case managers can be asked for support, and there might be other resources available as well. Mass Health certainly is the first port of call in referring to community support programs. So as I was talking about before, there's quite a lot of overlap in what these different professionals as part of the care teams do. The clinical care manager, care coordinator, client service case manager, and integrated behavioral health consultants. So some of the areas of overlap include referrals to community agencies. They're all part of a patient's care team. Both the care coordinator and the clinical care manager are both responsible for ER follow-up. All these different disciplines can contribute to a plan of care. They all promote healthy behavior changes. They can all do appointment management and reminder calls, and they can all help with transportation. So when we're working together with a team of people who can all do similar things, it's really important to kind of divide up the responsibilities and make sure that everyone knows what his or her role is and what they'll be doing as part of the patient's care team. So I want to talk a little bit in more detail about client services, who we are, what we do, and how to refer to us. So at Neponset Health Center and Geiger Gibson Community Health Center, we have a pretty robust team and program. Most of the client services team is based at Neponset, and the services that are offered are HIV medical case management, P2P, which is our parent-to-parent program. So this is case management for pregnant women and parents with children up to the age of 2. We provide social services to patients of the health center who need it, domestic violence advocacy and support, group case management in the form of housing and job search workshops. We also hold the food pantry every Tuesday at Neponset from 9:30 until 11:30, and this actually is open to the community. It's not just patients, but anyone in the community can come to the food pantry, and it is a really great resource for patients as well. We have access to different agencies that can provide clothing and equipment for children, so we can do referrals for patients that might need these things. We run several different holiday programs. So over Thanksgiving, we offer turkey baskets. We also do winter coats for kids, and we do Toys for Tots, which is we provide toys to children over the holidays. And all of these different services, we always send out emails and reminders about how to refer and when to refer to these different programs. So if you have patients that you're working with and you know that they're struggling around the holidays, just let us know and we will try to accommodate them the best that we can. We also run the medical interpreting services from our department, and we do HIV and Hep C counseling and testing. So at Harbor Community Health Center in Hyannis, there is one client service case manager based at the site, and the services that are offered are HIV dental case management, social services to patients of the health center, domestic violence advocacy and support, food cards, referrals to community-based agencies and resources, medical interpreting services, and HIV and Hep C counseling and testing. Referrals should be made through NextGen or by phone to Hyannis Client Services Case Manager. So here's just a picture of what the team looks like in the Boston sites. And you can see myself, Manager of Client Services. We have 3 case managers, Chris Petaruti, Joanne Vioslin, and Lily Vasquez-Scaglia. And then Marissa Goldman-Halpin works as the program coordinator for children and families within the department, but she's also the administrative manager for women's health. And so she's working closely with Allison Foley and the women's health MAs and nurses as well. And then we have Julia Lilly, who is a licensed independent clinical social worker and program supervisor. We have several different interns in our department. And we also have, you can see Tanya Morrissey, who's a clinical nurse supervisor for infectious disease, and Tim Curran, who is a nurse working in our department. They work closely with our infectious disease program. And we're recruiting at the moment for a client service case manager in Hyannis. As you can see as well, the interpreters are listed who are part of our department. These are Vietnamese speaking interpreters. We've got Chi, Lee, Quinn, Rebecca, Kevin, Yvonne, Trien, Sylvia, and Anthony. This slide is just to show you about some of the different options for housing for people. This is something that we can help and support patients with, and something we provide workshops on. As you can see, there are lots of different options for public housing and subsidized housing in the state. People can have Section 8 vouchers. They can have privately owned affordable housing. There's public housing, Massachusetts rental voucher program, and the alternative housing voucher program. And there's also supportive housing options as well. And this is just a slide to demonstrate that it is a complex system, and there's many different ways to apply, and we can educate patients about this through our workshops or through one-on-one visits. Housing is something that's very difficult to obtain. There's very limited low-income housing and public housing in the state, so it is very difficult for patients to get this, and there's a very, very long wait to get it. But what we can do is explain the process. The patient will need to follow up and to continue to keep the housing authorities updated about their addresses, etc. But it is a very complex and long system, but it is something that we can certainly explain and support patients in accessing the different parts of the system. And just another slide to talk about homelessness, as this does affect many of our patients. There's different ways to prevent homelessness. So people facing evictions or rent or financial issues, there are several different programs. As you can see at the bottom of the slide, it shows RAFT, home base, and homelessness prevention agencies that can support people in maintaining the housing that they already have. There are also special programs for pregnant women and families with children. The Massachusetts Emergency Assistance Shelter Program at the Department of Transitional Assistance. There's also special programs that will support people who are fleeing domestic violence. There are shelters for single adult men and women without children, such as Father Bill's, Rosie's Place, Pine Street Inn, and Long Island Shelter. And then there are also special programs for teens, teen parents, and pregnant teens. So we can support patients in finding the right fit and explaining the process on how to get into these different programs as well. So in order To access client service case managers, there's several ways to do it. If it's an emergency and someone really needs to be seen right away, can always page or call myself or any of our case managers to see if somebody can come right into the room to help. But if it's something that you feel you could refer, and we could then we'll then look at the different case managers' caseloads, and we'll assign a case manager. This is just a couple slides to show how to make referrals. So, in order to streamline the system, you would just we would really like people to make these referrals. You would open the referral template in the order plan section, and use the tabs across the top to navigate to referrals. Then you choose your type of referral, social services, by selecting the radio button next to specialty or specialist name. You add a diagnosis, choosing from the list. You can indicate the services requested. You can indicate the reason for a referral. It's really helpful for us to know why you're referring and what the patient needs and how urgent it is. So please include any comments or information you can. This will really help us to make the best fit to a particular case manager, and also to know how quickly we need to prioritize a patient's needs and issues. You can add any instructions you'd like, any attachments if you need to, and then you go ahead and place the order by selecting Add, and this will add the order to the patient's chart. Don't forget to save and close. And then you should be tasking all social service referrals to NHC Referral Social Services. Those come to me, the manager, and then I can assign a case manager to it. Here's just an example of a referral. You can see insurance is at the top, says social services, specialty, depression diagnosis. You can see the patient's in need of resources, patient needs support accessing resources, housing, food, etc. Patient is currently homeless. So this is just a example of what our referral might look like. And here is just a slide with our contact information. So as I said, I'm the manager of the department. We have Julia Lilly, who's our social worker and supervisor of programs. She manages the interpreters. Marissa Goldman-Halpin, Joanne Bioslin, Chris Petaruti, and Lily Buscaglia. And in our department at the moment, we do have some language capacity, all of the Vietnamese interpreters, as well as Haitian Creole and Spanish. So thanks so much for listening. If you have any questions, please feel free to contact me at any time to talk about the kind of referrals that can be made, the different roles of the different people involved in a patient's care team, or to discuss a case at any time. Thank you so much.